The typical presentation, but obviously we know it's a spectrum, so you kind of get all sorts of those sort of variations on it. But the typical presentation is often difficulties around social and emotional situations. So being able to read cues in terms of social interactions, having a certain amount of rigidity around certain things, but recognise and having a real interest in something. And one of the things that we found, in particularly around the neurodiversity and the autistic spectrum disorder, is that we often miss it with girls, because girls are really good at picking up the social cues of other girls and then what we call masking. So masking, in essence, is I pick up on how I'm meant to behave and I respond in a neurotypical way when I'm not actually neurotypical. And so some of the things that we can often see why girls, it doesn't get picked up as often with girls, is that girls may well have a neurotypical obsession or interest in horses, animals, dolls. So whereas we might, if they had, I don't know, something in trains, we might suddenly go, oh, that's interesting, that's not neurotypical. But often it can be in those sorts of things as well. So it's that finding it difficult to transition from one situation to another. When things change last minute, that can often create challenges, and then just really struggling to manage really big emotions. Now, obviously, as a parent, you're always trying to kind of sort of manage those sort of situations. I think my view would be that whatever happens, whether we've got a neurotypical child who's just developmentally struggling with their emotional regulation, or whether we're dealing with a neurodiverse child, is that fundamentally what we want to do is the same. It's focusing in on the skills and the gap that we want to do. So we're always going to be focused on that. I think where we might seek some professional help, and whether that's a diagnosis or additional support, is where we're seeing that it is significantly impacting our child's ability to go to school, regulate emotions in those sort of situations, and being able to go to sleep, being able to manage normal day-to-day transitions from one thing to the next. That's probably when we might then seek some professional advice, and having a conversation either with school or the nursery to see whether they are noticing, particularly when we're talking about neurodiversity that is at the attention deficit spectrum as such, is that in order for it to be attention deficit, it has to present across more than one setting. So if they're not seeing it at school, if none of those issues are happening at school, but you're seeing them at home, it's unlikely to be. So having those early conversations is also helpful too.